One of the most scariest things about PE is that it doesn't always look scary. You're in P-Pal here. Welcome to another lesson from the track. All right, let's talk about it. So today's segment, I want to talk about PE. It's not hard. You just need a system. All right, so we all know pulmonary embolism is not very common, especially in urgent care, but it's something that you should definitely keep in mind. I had one last year, or had a high suspicion of one. The patient came in and she was elderly, I would say, 60 plus, came in with shortness of breath, and that was really it. No cough, no congestion, no fever, no nothing. She was tachypnic, like she wasn't like struggling, she was just, right? And it had been going on for about 24 hours by the time she came into me. So, of course, I'm just looking at her, and you know, a lot of times, especially during cold and flu season, we're just like, okay, you know, is this flu, they have a temperature, or is this pneumonia, you know, kind of one of those things there. And pneumonia is always kind of the first thing that we kind of think of, like worst case scenario with shortness of breath. So while that is something that's on the differential list, you also don't want to just anchor on that, okay? So of course, like I mentioned in a previous video, the interview is one of the most important parts of the entire visit, okay? So definitely you want to look at everything and ask more questions, especially if the vital signs aren't terrible, okay? So how you start with the approach for PE. I just like to keep things simple, as you know, if you've been watching my videos. So for PE, I just approach it like this. They have chest pain, shortness of breath, tachycardia. I say assume PE until proven otherwise, okay? Because those three things there. And another thing with PE that makes it scary is that the breath sounds are usually normal, okay? You're not necessarily gonna hear anything. Why is that? Because remember, PE is a vascular problem, okay? It's not in the lungs or airway, it's in the vessels. So remember, usually it's from a DVT, so deep vein thrombosis. So a piece can break off, travel up to the lungs. Still vascular, okay? So don't just assume it's pneumonia, because I've known providers over the years that has happened. But PE is one of those things that, of course, can kill patients, okay? Let's give them an antibiotic and yeah, they go home and die. So you definitely want to avoid that, okay? So if they have those three things, of course, automatically I'm getting EKG, okay? So while that's happening, definitely want to go to your resources. So one of the things that you can use is the PERC rule, P-E-R-C rule, which can be found on the app MD Calc, which I highly recommend for any provider, not just urgent care, but also if you work in the ER and things like that. The app is MD Calc. It's a great tool, great resource, it's free. You just put your information in, depending on whatever it is, and it'll give you the score. So part of the PERC rule, it has 6 components. The first one is age, which is if they're greater than 50. Second one is heart rate greater than 100. Next is oxygen less than 95%. Other one is unilateral leg swelling. There's recent surgery or trauma. And then hemoptysis, which is also a very late sign and not very common, okay? Now for the PERC rule, it's more to rule PE out, okay? And it's also for like a low risk patient. So if you're kind of just like, maybe, it's good to just plug it in there, and patients will get points, you know, depending on how they score, okay? So again, that's something that you can easily do there, okay? So for this patient, of course, I got an EKG, and other than her breathing, she didn't look bad. Her heart rate, it was like 103, 105. So it wasn't crazy where it's like 115, 120. She wasn't having any chest pain, but she was short of breath. Lung exam was normal. So, of course, I'm just like, okay. So knowing that those components of the PERC score, or the PERC rule, I know to ask those questions during the interview. So she hadn't traveled anywhere. There was no leg swelling. And also, she did have surgery. Now, with the surgery, it usually says within 2 to 4 weeks. So something recent, there's a higher incident. Hers had been over a month, but she was still like in physical therapy, not moving around. And that's the thing, they don't come in just clear, right? It's not like everything's just gonna perfectly fit within this. That's where your whole judgment and your framework definitely comes into play, okay? So it's not just gonna be perfect, but if they have enough of the symptoms, it's just like, I don't like this, okay? And so yeah, so go from there. So EKG looked fine. And one thing on the EKG that you may see with PE, there's nothing like really specific or something that you're gonna see. Most often you'll just see like sinus tach. So it's just gonna show that it's beating fast in most of the cases, okay? Of course, there are some kind of particular specific things you can look for, but you don't necessarily have to go that deep, okay? Because if you're thinking it in urgent care, they need to get sent out. Remember, nobody's diagnosing the PE in urgent care. Remember, like I said in another previous video, a lot of times we're like traffic directors, okay? Like we're in the middle, we can kind of direct them, hey, can they follow up safely outpatient? Or is it something where you need to go to the hospital quickly, okay? So for that patient, EKG didn't look terrible. Her surgery was over a month, but she still had recent surgery. She didn't have any swelling. And then I did a chest x-ray. So while that was happening, I was just like, I don't like this. I don't like this, you know, like, and there was actually a doctor there. He was doing some chart reviews, and I remember talking to him about it. He didn't seem that interested. He was like, yeah, whatever you think. Oh, thanks, thank you. But anyway, I was just like, yeah, my spidey senses were tingling. So if you're skeptical about it, send them out, okay? Now, as far as how they should go to the hospital, okay? So not everybody needs to go EMS, okay? Remember, it has to do with their stability. Are they stable? Are they unstable, okay? So this lady, again, she was, I would say she was stable, but you just have to be careful, okay? So definitely recheck the vitals, recheck everything. You know, if they're, again, 105 is not terrible. Her oxygen was, I think, 96, 97, so it wasn't there, but you gotta think, people can compensate for a certain amount of time, and then that's when they go down. So if you decide to let them go POB, first off, are they with somebody? How close is the hospital? So this patient was, she actually had a family member with her, and there was a hospital like not even 10 minutes away. So I felt comfortable letting them drive because I didn't think it needed EMS. That would have been a little too dramatic, okay? So again, just weigh your options, but I mean, if it's one of those situations where they're by themselves and they don't look well, you know, because a lot of times you throw EMS out there and they immediately go to the bill, which I understand, but at the end of the day, this is safety first. So I just went in there and told her what I was thinking. I was like, look, I'm concerned you may have a blood clot in your lungs because I checked you out, your lung exam is clear, there's nothing to really explain it. Yes, you had surgery over a month ago, but you're still kind of within that range. And so that's something that you just want to go get checked out, okay? And again, like I always say, if you tell people why, okay, why you're doing something, they usually will receive it better, not just, oh, you need to go to the hospital. So you definitely want to explain what you're doing, okay? So again, just to recap, so chest pain, or shortness of breath, or tachycardia, start thinking PE for sure, okay? Use the PERC score. There's another tool that's called the Wells score, okay? So Wells is another one. They actually have one for DVT and PE. And so you can also use that as well. But again, if you're even thinking about all of this, that means you have a high suspicion, right? So you're already thinking, and don't try to just like downplay and things like that. So if you're suspecting it, they need to go, okay? Because again, that's one of those things that they can go home and die, like seriously. So always be cautious, always give those precautions and just kind of let them know. So those are your two options as far as how you can check for it, okay? Because we don't have the blood tests there, and so even with a D-dimer, you know, that's an outpatient test, but let the hospital deal with that, okay? So yeah, that's pretty much it. Don't just overly diagnose pneumonia or just assume that everything is good. And that's the thing. It's the lung exam that will kind of like, oh, this is no, they're not fine. Don't downplay because again, they're probably gonna have a normal lung exam, okay? So that's pretty much it for the approach to PE. That's why I said it's not very difficult if you have a system, if you have a framework in place, okay? So if you want additional information, I do have a handout that is part of the system I created, and the link will be in the description below. And as always, your MP Pal here, practice boldly, and I will see you on the next one.